Hi everyone, welcome back to another YouTube video. I'm really excited to talk about today's topic because it correlates to so many different conditions, so many different ailments, so many different things that oftentimes people are coming in to see me for. So I'm very excited for the topic today. For those that are new, hello, welcome. My name is Dr. Elise Tercy, and this channel is devoted to all things holistic health and wellness related. Thanks for tuning in. For those guys that are back, of course, I'm happy to see you guys back here again. So let's just dive into today's topic, which is all about inflammation. I know that we know this. We hear about this. It's not necessarily something that we are like, what's inflammation? But I'm going to connect it to what happens when inflammation goes awry or the inflammatory process stays on for longer than we would like it to, and how that affects our health, how that affects our ability to fight off disease and chronic conditions. Because at the core of most, if not all, chronic conditions is inflammation. So let's dive in to talk a little bit about what it is, how we know we're inflamed, what to do about it, why it's problematic long term, and all the nitty gritty about that. So let's dive in. What is inflammation? What is it? We hear about it. We know it's associated with maybe damage, but inflammation is actually a vascular and cellular response to tissue trauma. And the trauma could be external trauma, like maybe we fall, we break something, or internal trauma coming from inflammation caused by bacteria, fungus, virus, protozoa, and critters. So really inflammation, it's kind of an umbrella term. When we think about what is it, it's actually an umbrella term that encompasses all chemical changes that are occurring within tissue that make the tissue initially inflammation's job, if you will, is to make the tissue healthier. But if we keep that inflammatory process happening longer than it should, we actually can create more damage than good. Why do we have inflammation? What's the point of this? If it hurts us, it kind of sounds like it hurts us, right? We have that connotation with it. No, that is not true. Inflammation actually helps us. When we're inflamed, it's actually a signal to our body to say, wake up, something is going on here. Wake up, something's not right. Inflammation is the clue. It's the signaling system that tells our body we need help. We need repair. We need to get all of the cells that are going to be helping us to rebuild, regenerate, repair the tissue. We don't want to quiet down inflammation, which a lot of us, that's what we do. We have an ache, we have an ailment, we have a pain, and we think, let me quiet down this inflammation because it's bothering me, which we'll talk about the symptoms of it. That is not the right thought process. So I really want to encourage you guys to understand that inflammation, it's so helpful. We have it for a reason. We don't want to turn off the signaling system, kind of like a fever. I'll give you guys an example with a fever. So fever is an inflammatory response. Fever tells us that we are raising our body temperature because we're trying to get rid of things inside of us. And we're basically telling our alarm, go off. Get everybody, round the troops. We need help. We don't want to quiet down that process because when we quiet down that process, the signaling system gets turned off. And we need the signaling system on so that our body can understand and can recognize we need help. So in and of itself, inflammation is not a bad thing. I know it gets a little bit of a bad reputation. A lot of us think that inflammation is bad. It's bad for us. We shouldn't be inflamed. While that's true long term, there is a benefit to it in the short duration. The problem only arises when the inflammatory cascade and the cells associated with it are not able to turn themselves off. And so what happens is our body says, do it again. Keep going. Keep trying to fix the problem. Keep rounding up the troops. Keep rounding up the leukotrienes. Keep rounding up the mast cells. All these cells that are pro-inflammatory, histamines, tissue necrosis factor, interleukins, mast cells. These are all cells that kind of come out of the woodwork to help us. But if they stay on long term, problems arise. Inflammation is, like I said, an umbrella term, and each tissue can undergo inflammation. So every single piece of our body can actually undergo an inflammatory response. So there's nothing that inflammation doesn't touch. It can affect everything. Imagine a fire. God forbid, but imagine a fire in a space. It's not like the fire stays contained and says, oh, we're going to just stay in this one room. When there's a fire, every single thing is involved, and it touches everything, the walls, the floor. That's the way inflammation works, and typically it spreads. So inflammation in one area of the body, we name it, we call it something, right? So for example, inflammation of the thyroid, we diagnose it or we call it maybe hypothyroidism. Inflammation of the vascular system, we call it vasculitis. Inflammation of the heart, we call it maybe cardiomyopathy. Okay, we name inflammation depending on what organ it is attacking, but every organ system can undergo inflammation. Always go back to that fire example. Every single tissue can undergo inflammation. And the point is to keep the inflammation process not turned on, to kind of keep the inflammation process turned off. What causes inflammation? If we're not doing anything in our world, like we didn't break something, we didn't fracture a bone, we didn't have tissue trauma, what's the cause of inflammation then? A lot of times there's so many factors, and it could be nutritional imbalances. So we can develop inflammation when we don't have enough stuff. Maybe we're lacking on certain vitamins and certain nutrients. That's a cause of inflammation. Another cause is that we are bombarded by critters, by microorganisms. So mold exposure, toxic mold, mycotoxin exposure, viral load, all different viruses, stealth infections. I'll call it C19 for the sake of the video, but that creates inflammation. So we'll use that analogy just for right now. We're all undergoing a pandemic, global pandemic. And what's happening is that this virus is going in our body and creating a lot of respiratory inflammation for people. Okay, so we name the virus, but that's the etiologic agent. That's the organism that says problems are happening, problems are arising. And so the inflammatory cell, if you will, could be coming from viruses, bacteria. So for example, an example of a bacteria could be Helicobacter pylori, H. pylori infection in the stomach. That can create inflammation, that can create gastritis. So I just want you guys to kind of take home the message that inflammation is the driving force behind metabolic disease. Inflammation is the driving force behind tissue damage. It's the cause of chronic illness. It's the cause of aches and pains. It's the cause of pain and redness and achiness in our body in terms of the symptoms, but we name it. Okay, so we talked a little bit about where do we get this from? Like how do I become inflamed? Like we talked about maybe a external ailment. We break a bone, we hurt ourselves, maybe trauma, repetitive micro trauma. So for example, someone that's exercising. So while exercise is a very good thing, it creates micro trauma. What happens is literally what you're doing is you're ripping open the sarcomeres, you're ripping open myofibrils, you're ripping open muscle tissue, and you're dumping cytokines, you're dumping pain signaling systems. It's not a bad thing, but it does create a low level of inflammation. So people that are in the exercise space, I'm just using this for an example of a micro trauma that creates inflammation, is their exercise, damage. We do need the repair mechanisms. Okay, so we really only get into trouble when the issue becomes overburdening to the healing process. Okay, so the issue becomes overburdening to the healing. If they're equal, fine. So we create inflammation. It's almost like imagine cleaning your room. You make a really big mess, or let's just say it's a kid. Hopefully if you're an adult watching this, you're not making messes in your room, but let's just say you're a kid and you're making a mess in the room, but you're gonna clean it up. So fine, that's okay. What's the problem? Nothing. We make a mess, we clean it up. That's a good thing. That's what we want. That's the goal of the body, is that we make inflammation, we make a mess in our body, but we can clean it up. We have those tools. We have the repair mechanisms. We have the things that we need. It only becomes a problem when we don't have the mechanisms to heal, repair, replenish, reactivate. And that could be coming from a lot of different reasons. So inflammation can be external, micro trauma, exercise induced, internal, bacteria. We talked about H. pylori, Helicobacter pylori, Lyme, Borrelia burgdorferi, Babesia microti, internal bacteria, spirochetes in general. It can be coming from viral load. Okay, so we'll call it C19, different types of species, different types of herpes viruses, Epstein-Barr virus, cytomegalovirus virus. You guys know I'm all about really triaging and making sure there's no viral activation. Candida, so spores, yeast, protozoa, mold, environmental toxins. So we'll use the analogy that I'm in this space, I'm in my office right now, and I don't know if this space has been cleaned. I don't know if there's, the HVAC system has spores in it. I work with people that call me and say, my home did have mold. I had a moldy mattress. We did have water damage. And then all of a sudden, chronic conditions started to happen. So externally, critters in our environment, those that travel on the New York City subway systems, they're breathing in stuff. Who knows what's down there, in the subway systems. But the whole point is that we get bombarded by stuff, call it what you want, and we mount this response. That's fine. That's normal. That's what we should do. Really, we get into trouble when the inflammatory response can't keep up with the damage or the trauma, wherever it's coming from. So what ends up happening is that our immune system, it's always on. Normally, we turn it on, we turn it off. Imagine a bell-shaped curve. Normally, under a normal mechanism of action, we turn on inflammation and it turns itself off based on getting back to homeostasis. What happens though, what the problem arises is when we turn it on and it stays elevated, the inflammation stays elevated. We don't drive that process down. And that is where we create chronic conditions. That's where we create chronic damage. That's where we start to say, I really don't feel good. Long term, I'm not losing weight. Okay, so with that said, let's dive into a couple things symptoms-wise that we can correlate to inflammation. Like, how would I know from a symptoms perspective if I'm inflamed? You would know because you don't feel good. And that can show up as many different things, one of which is pain. So a lot of times when I'm working on people, maybe more manually, and I'm palpating, and areas that shouldn't really be tender to the touch are tender to the touch, absolutely inflammation. Absolutely inflammation. So if you palpate a body and someone says, ow, that hurts, but really you're not doing anything excessive, you're just touching and palpating, there's something going on inflammatory, because what happens is the cells of inflammation, it creates this massive storm in the body, as it should, but it is associated with tissue trauma, and we feel it as pain. It shows up as pain. Pain modulators, cell mediators show up. So that's a sign. Any type of pain in the body means inflammation. Hot, heat, red, irritated, all of those things could be signs of inflammation. Other signs that are not as obvious, but I do want to share with you guys that are more chronic signs of inflammation, are inability to lose weight. Brain fog. This is a huge one that I see in practice, and women oftentimes will say, I have brain fog. I have like fuzz in my brain. I can't really find clarity. Inflammation isn't just neck down. It doesn't just, stop at the neck. Having brain fog means we have brain inflammation. So a lot of these inflammatory cells can travel through what's called the blood-brain barrier. They're able to seep through and they can go into our brain. So inflammation of the brain shows up as cognitive disorders, Alzheimer's, different types of beta amyloid plaquing in the brain, cognitive deficits. There's so many things that can happen. Tau protein aggregation. These are all signs of inflammation in the brain. And we do care about that because it's not just neck down. Like I said, I don't know why we have this stigma that inflammation only does stuff to our thyroid and to our adrenal glands and to our ovaries. No. When someone has brain fog, there is inflammation that's traveled to the brain. So that's another symptom. How would you know if you're feeling inflamed? It's not as obvious as I see it on my body where, I see the actual thing happening. I see the actual pain. It can show up as these subtle signs that I'm exhausted all the time. I'm fatigued all the time. I can't remember things. I walked into the room and I forgot why I was coming into the room. I'm fuzzy. I'm not clear. Those are other signs. Those are more chronic signs. Those are more like subclinical, where it's not as obvious, but they are signs of inflammation. Can we test for inflammation? Yes. A lot of people want to know, are there actual inflammatory tests that we can do? There are two in particular, but that's That's two of many of them. Two of them are, we'll talk about them. One of them is called an HSCRP, so a high sensitivity C-reactive protein. It's an acute phase liver protein. It's a protein that comes out of the liver, and it comes out in response to a signal in the environment, in the periphery. So if there's inflammation somewhere in the body, the liver will say, let me help you. Let me give you something. Here, take this cell. So that is one of the markers that we can find through blood work. It's an HSCRP, and then also a SED rate. So an ESR, erythrocyte sedimentation rate, has to do with how sticky the blood vessels get, the blood gets, how clotty we get. That's another cell that we can look at from the blood perspective. But anytime someone has blood work that shows up with inflammation, for example, antibodies to their thyroid, inflammation lives in the thyroid then. So we can kind of connect different body parts with different cells. Long term, the problem arises, especially with immune system modulation, is that if the inflammatory pathway, if it stays on for a while, you start to have funky things happen with your immune system. What does that mean? What the heck does that mean? A funky thing happens to my immune system. You will actually start to turn on autoimmune cells. You'll start to turn on your immunology cells. So for example, you might have a positive anti-nuclear antibody in your blood work. You might have a titer value that's showing up as 1 in 80, 1 in 310, 1 in 360, 1 in 140, 1 in 440. These are all titer loads that tell us that your immune system is irritated. And there are many different types of antibodies, if you will, that are associated with a positive ANA. So that's another way, I guess you can think of it. We can tell from the blood work if someone has immune system dysregulation from inflammation. Is we said HSCRP is number 1, ESR is number 2, and number 3 would be an ANA, an anti-nuclear antibody titer with a specific pattern. And the pattern tells us about what potential disease we're dealing with. Is it scleroderma? Is it PCB? Is it Hashimoto's? Many different conditions can be associated. Is it rheumatic irritation? Is it autoimmune in nature? Is it triple digit viral load from Epstein-Barr? Even mold can turn on a positive ANA. So there's so many different things that we want to know about. But long term, the problem is that if we stay stuck with an inflammatory process, it leads to tissue damage. It leads to the turning on or the activation of the immune system. And when you start to do that, that's where we don't want to be, because the theory around different types of cancers is there's this immune dysregulation. We're not able to contain our immunology. We have all different cells that are going haywire, and that can create problems and distress for us. So we start to activate all of these different cells. So all these chemokines, chemoattractants, different types of nitric oxide species, different type of mast cells, different types of endothelial cells get activated, and they kind of get to do what they want, and they create problems. So if you take anything away from this video, I know we're talking about a lot of things. I just want you guys to know that inflammation in and of itself, short-term acute inflammation, that bell that goes up and comes down is okay. But if you're repeating that pattern over and over, that bell starts to stay up and you are not able to turn off that inflammatory process. There are different autoimmune conditions that can develop from chronic inflammation. Can we reverse this? Yes. That's the point. Preventative medicine, immune system modulators, there's different enzymes that can help the immune system, herbs, plant-based botanicals, homeopathic remedies. Yes, totally we can reverse it. That's the goal. So we can bring you out of inflammation back into more homeostasis with certain things. And so really that would be working with someone like myself that can say, where are we showing up with inflammation? What lifestyle factors are we doing that's contributing to it? So we didn't talk about this yet in the video, but nutritionally, are there things that I'm eating? Are there things that I'm not getting enough of? And I know that we all kind of make light of vitamins. So for example, like, you know, when we were little, maybe we took a Flintstone gummy, and a lot of people are not, they just don't get enough stuff from a vitamin perspective. We're deficient. If we have vitamin and mineral deficiencies, if we're deficient with certain elements, we will create a stronger ability to create inflammation. If we don't have zinc, if our zinc is 60 units, if we don't have vitamin D, if we're below 45 units of vitamin D, if we don't have enough vitamin K, if we don't have enough of the B vitamins and the C, we are putting ourselves at risk, because these cells are all things that help us protect ourselves from keeping that bell curve up, keeping that inflammatory cascade on. So vitamin and mineral deficiencies are another cause of inflammatory processes. Digestive issues. If you are dealing with a digestive issue, there is inflammation. And the concern is that long term, that creates problems. So for example, maybe I'm a little refluxy, I have a little tightness in my chest, maybe I'm a little burpy, I don't think much of it. Well, there could be a lot of stress happening within the stomach. You might be dealing with acid reflux, you might be dealing with bile reflux. Long term, keep that pathway going, you can erode the stomach tissue. And now we have gastritis. Over time, we actually start to change the tissue type. So we change the tissues of the esophagus to a different type, and we actually can develop something called Barrett's esophagus. We can have esophageal spasms. It's precancerous. The point is that if you leave inflammation as is without supporting it, you are running and risking things in terms of cancers, because that's what it is. It's almost like inflammation is kind of like the start place. Avoiding inflammation leads to chronic inflammation. So we go inflammation, acute inflammation, chronic inflammation, disease issues, dysregulation, potential cancer, kind of the pathway to destruction. So inflammation is a very big deal, very big deal. I know I'm kind of off on tangents, as that's kind of normal. If you're new here, you'll probably learn that I have so much information I want to share. I sometimes have to reel myself back in. But we're not going to dive into it in this video, but I do also want to just touch a little bit on Th1, Th2 immune system stress, because what happens is that different parts of our immune system, whether that be the innate or adaptive immune system or the humoral system, we can turn on one or the other, which certain conditions are more associated with the Th1 dominant tissue response versus a Th2 dominant response. All that means is that depending on the types of chemoattractants, depending on what cells are activated, T lymphocytes, B lymphocytes, different immune system things can turn on. Different how can I describe this? Different conditions arise. So if we go one way, we develop these sets of inflammatory responses. If we go another way, if our immune system goes in this kind of pathway, we can develop other ones. So there's a little bit of a difference in the immune system response and which one we might activate. Nonetheless, we want to keep both of them quiet. Whether it's a Th1 response, some of them are more associated with different types of mast cell activation, different types of eosinophilias, different types of itchiness in the body. That's kind of one of the responses. And then there's other ones that are associated with different conditions. So we're not going to really dive into that. It gets a little bit tricky. It's very nitty gritty. But the point is that we want our immune system balanced. How do we do that? We do that through nutritional therapy. We do that through clinical nutrition therapy. We do that through making sure our body has enough enzymes. We do that through making sure we have enough stuff, vitamins and minerals and nutrients and cofactors and coenzymes. We make sure that we keep inflammation down by having good gut health. These are all ways that we kind of quiet down the inflammatory response, because if it's turned on, problems arise. That's all I have to say. I hope that you guys gained a little bit of value and learned something new from this video. I hope that you really understand, if there was one point that you took home, inflammation is not a good thing long term. In the short term, yes, it is, but long term, we don't want it to happen. So please drop a comment down below if you have questions about this. If you are someone looking to do some comprehensive lab work in New York, please connect with me. I can guide you as to what that looks like. And as always, don't forget to give the video a like if you really enjoy this content, and click subscribe so that you can stay up to date with all videos that are coming out that are involved with health and wellness. I'll see you guys in the next one. Thanks for tuning in.